Hey, everybody. I want to welcome everyone to Tales from the Trails. I've got Alex here with me. Alex, thank you so much for joining us today.
Thank you so much for having me.
If you don't mind telling the audience what company you work for and what your role is in that company.
My name is Alex Waddell. I'm the Chief Information Officer at Adobe Population Health. We're a population healthcare company that partners with Medicare and Medicaid plans to serve underserved members in our communities. We service the Southwest. We're currently in 3 states, and we just try to provide resources and much needed care. We don't really do hands-on work. We're not a home health organization. We're not a surgery center, anything like that. We just go into the home and contact the members and help them navigate the complex healthcare system.
Awesome. So what states are you guys currently serving right now?
We're currently in Arizona, Nevada, and New Mexico, and we're constantly growing and looking to expand into multiple states this year and beyond.
Okay, great. So you kind of mentioned that you guys don't do a hands-on approach, but you'll go into the homes and just assist with any needs. So are you guys basically like case managers, or explain a little bit more of your role?
Yeah, absolutely. So Adobe Population Health, as I said, we partner with Medicare and Medicaid plans, and what they generally do is give us a population of members that are utilizing the hospitals very heavily. They're not going to see their doctors, and so therefore the healthcare costs rise very rapidly. When something goes wrong, they think emergency room immediately. So what we do is we stand in between them and their providers and the healthcare system in their area and help them navigate. So instead of going to the hospital, we remind them, hey, did you drink any water? We also provide much needed support on gap closure. So these are like cancer preventative screenings, blood pressure monitoring, things that if we don't keep a close eye on them can grow into bigger problems. And we know that the primary care physicians only see the member when they show up and when they decide to schedule. So we provide a very much needed, like boots on the ground kind of support to the members. And again, yes, we just help them navigate the healthcare space, providing them with resources. We really believe in tackling what are called social determinants of health. And these are the socioeconomic issues that face our families and our members every single day. Things like not having enough food, not having transportation to go to your doctor's visits, not being able to read. These are barriers that get in the way of care. And if we don't help support them, then the members are left on their own. So we provide them with food banks and translators, and we help them understand their medications. And we believe that if we provide that much needed socioeconomic support, that we can reduce overall healthcare costs by improving the quality of life. And that's our mission here at Adobe.
That's great. I love that. So I know that there isn't one way that you guys really address. Each member is really individual. And I know that we had talked previously, and you guys pretty much do whatever you can to help. Do you want to tell us some of those stories about some of the things that you guys have had to do for some of your members?
Absolutely, yes. So every home that we walk into is a completely different situation. As you said, we don't have a one size fits all for case management, which is really a differentiator between Adobe Population Health and some of our competitors and people in the industry. We've seen all types of things. And some of the funny stories or fun stories that I like to tell are, for example, one woman, we contacted her on the phone to complete some gap closures. And she said, I'd love to have you out, but I'm afraid to leave my house because there's a bobcat living underneath my house. If you can't fix that problem, then don't bother showing up. And we're not animal control. We don't really know what to do with a bobcat living underneath your mobile home. But we do know how to contact people. We just start making phone calls. We just contact animal control. We contact whoever we need. We got the bobcat out, and she's been on case management for years. Another family were having septic tank problems. Again, we don't manage septic tanks. I don't ask my nurses to go out there and empty septic tanks, but we know how to find the resources that can. And usually we find grants. A lot of this has to do with people not having the financial ability to pay for these types of things. So your septic tank just goes unserviced. Maybe they're in such a rural area that they just don't even know how to schedule a routine empty. So we set that up for that member and their family, and they've been on service with us forever. One last story is kind of a weird one, but we had somebody who was living on the streets and was just really down on their luck. And so we wanted to get them into a shelter, but the shelter couldn't receive them for a week. So our CEO busted out her credit card and paid for the hotel herself. Not that she even needed to, but because we have a lot of cards out there, but we're just the type of people that just do whatever it takes in the moment to get it done. No bureaucracy slowing us down. We just do what we need to do. Yeah, those are some of the stories, and it's just incredible work that we have the privilege to do.
Yeah, I love that. I love all of the different things that you guys come into. And one of the great things that I love about your company is that you guys aren't just virtual. You guys are going into homes. You're taking that really hands-on approach. And I really love that. So this kind of moves into our thesis. So we believe that every business and organization, they have a mission statement that they're trying to deliver. Can you guys tell us what your mission statement is?
Yeah, our mission statement has always been to positively impact the lives we touch. And so that's, of course, for our memberships. And to call back to what we were talking about earlier, just solving those socioeconomic issues. We believe that if we solve those problems and improve quality of life, that not only does the member get healthier, but we also can reduce the overall healthcare costs for the population. But also, we believe in impacting every single person. Every life we touch is our employees, every vendor that we work with. That's really our philosophy. And we try to embed that into every employee that works for the company.
Okay, Alex, what made you get started with this company? Did you always have like a health background or how'd you get
No,
started?
yes, it's a bit of luck or who you know. So I started with a company called Beach Medical Group out of college. I wasn't always thinking of getting into healthcare, but an opportunity presented itself with that company. And over time, that company sold, and Jamie Ambrose, our current CEO, purchased the case management contract. And I continued on through and carried on the mission of positively impacting each of our members. I've just been along for the ride. It's been a lovely ride.
Awesome. And so I now understand that your company is based off of Salesforce. Is that correct?
Yep. So almost all of our infrastructure is built entirely on the Salesforce platform. We are
Gotcha.
very lucky to not have other disparate systems out there.
Awesome. So, Alex, I got to ask, what made you want to get started with this company? Did you always have a health background or was this something that you fell into?
Yeah. So to start all the way at the beginning, I was an economics major at Arizona State University. Anyone who's an econ major knows that you're relegated to sales jobs. And so I was out there trying to get my first job, and the only company that called me back was Enterprise Rental Car, and I'm very grateful for that. But I knew that I didn't want to sell rentals, and I didn't want to work in that. I was stuck in limbo, and so I happened to be at a family friend's house for 4th of July, and he's a business owner and pretty successful. And my wife said, "Hey, you need to go talk to Michael," was his name, and just ask him for some advice, see what's out there. I had no idea what the options were. I approached him and said, "Hey, would you mind having lunch with me?" And he said, "I can do breakfast next week." And so I showed up to the breakfast, and I always like to talk about how I was like, recent college grad. I had hair down to the middle of my back. I was wearing a tie-dye shirt and shorts, and turns out it was my interview. I didn't know that. So I was made for a very kind of awkward breakfast, but that was okay. And he asked me, he said, "Have you ever thought about getting into IT?" And I said, "Like computers? No, my brother likes computers. I don't really like building computers. It's not my thing." And he goes, "Okay, well, what about software development?" And I said, "Oh, like coding, like I've tried it, not very good at it. I didn't really like it." So he goes, "Okay, how about a business analyst?" And I said, I have no clue what a business analyst does. And so he explained to me that's somebody that kind of stands in between the technology and the business side and helps both sides navigate the world and, of course, provide the data that helps the company succeed. And so I said, "Oh, that sounds interesting. Okay, that's great." So I left that interview, and again, I didn't know it was my interview. So I left that saying, "Okay, there's a thread for me to pull on." And turns out he actually called my dad immediately afterwards and said, "I think I want to hire your son to come in and help me build a system." He called me back and said, "Have you ever heard of Salesforce?" And I was like, "I don't want to do sales, man. I don't know what this is." And he said, "No, it's a system. And I'm using it to build an EMR from the ground up, an electronic medical record for my business. Would you like to come in and be my administrator?" And I, not having any other opportunities out there, I said, "Sure." And so I started up with Beach Medical Group and started my Salesforce journey. And that kind of transformed into Adobe Population Health. And I've been along with this company and with my mentor and also Jamie Ambrose, our current CEO, this entire time. So.
That's great. So I've got to ask, because this is like a badge of honor when you're in the Salesforce ecosystem, how many certifications do you have?
I have 5 certifications in total. So one of those rolls up into the application architect certification. I'm a boot camp kind of guy. I love going to those events. And so Trailblazer DX is like my favorite conference of the year. And I
Yeah.
always try to get a certification while I'm out there.
Nice. I love it. So you guys built the EMR, the electronic medical record system, off of Salesforce. So is that basically what houses your program that you have or that you communicate with to your members?
Our EMR is configured to run our entire business. So whether that's clinical or operations, to scheduling to billing. We've been able to use the Salesforce platform to basically solve any challenge that happens in our business. Now, I don't like to reinvent the wheel. We don't do accounting on Salesforce. We have systems for that. We don't have HR in Salesforce, but what we do and the type of case management that we do, and we've alluded to this a little bit earlier, is that we take a different approach to case management and healthcare. And so there's not a system out there in the world that does healthcare in the way that Jamie, our CEO, imagined. And really, this EMR is built on her college thesis, on her doctorate thesis, on how case management is done. So I basically had to sit with her and figure out, take her brainchild and her idea and turn it into a system, and then also get all the downstream business processes built in as well. We have a Salesforce, but a very mature org. We don't use any cloud solutions. We're not on Health Cloud. When we were coming up, Health Cloud and our EMR were being built in tandem, and we've had a great relationship with Salesforce and their health and life sciences team to building systems out. I think that Health Cloud is getting very close to where it would need to be for somebody like me to use it. But because we're doing something novel and unique, the Salesforce platform, I like to call a Lego box. I'm not starting out with a pre-configured Millennium Falcon, but I can build a ship myself, is the kind of the way I like to say it.
Nice. I love it. And you guys don't just help out your customers. You guys take the time to help out your other companies as well. And because of your solutions with patient billing and care data and health insurance validation, you guys, and I quote, have saved a company more than 5,000 work hours annually and over $439,000 in total labor and efficiency value. So that is pretty impressive. And that's amazing that you were able to build the system like straight off the Salesforce platform. That is pretty incredible. So if there's something in your industry that you would like to improve on, or if there's any need that your industry have, what do you think that would be?
No, of course, the big challenge in healthcare is standardization and interoperability. We don't communicate with each other. Doctors don't know what we're doing. We don't know what they're doing. And it really makes for bad data, which ultimately makes for bad experiences for our members. Because if they aren't getting their claims put in, and let's say, for example, there's a program called risk adjustment. This is something that they need to do, members need to do on Medicare every single year to have their benefits match their needs, right? And so if we don't complete that and we don't capture that the member is diabetic or may have had an amputation every single year, then Medicare may, just because they're working with billions of lines of data, that person might slip through the cracks and not get the support, not get the medication that they need. So really, there's just mountains of data that need to be moved and need to be made sense of. And I know that there are industry standards out there that are trying to do their best. HL7, FHIR. When it comes to social determinants of health, there's groups like the Gravity Project out there that are trying to standardize these things. That's something that we really need to get down to. We can't be so rigid that everyone has to use the same system and therefore it doesn't work for anybody. But we do need to be able to communicate with each other, whether that's through health exchanges or direct integrations. And really, it's hard for the doctor's offices, let's say, for example, to have the time to implement technology. So we also need to bridge that gap too. When we go into doctor's offices and say, we have a solution for you, we'd love to implement something like our Maslow solution in your doctor's office. They say, this is really great and it could have an impact, but I don't have an extra 15 minutes. I don't have the resources to integrate this with my system. I wouldn't even know where to start. And therefore, everything just stops. So you probably have experienced the same thing. I think we all have at the doctor's offices. You go in, you sit around, nobody's in the room, the doctor comes and talks to you for 5 minutes and he leaves. That's because they're so busy and inundated with bad systems and lack of data that they just tackle the challenges right in front of them. They can't actually tackle things around them. So Adobe Population Health really tries to fill in those gaps and share data. That's really ultimately what my team, we spend most of our time just moving data around and making sure people have the right information.
Wow. So what does the next 12 months look like for you guys?
Incredible growth for us. We grow 100% year over year at a minimum. We double in size by revenue and by bodies and by membership. We're expecting to onboard by the end of the year at least one more state, but by the end of next year, we expect 3 or 4 or 5 more. Our platform is really beginning to become something that's scalable. It's something that's challenging when you're building something on the platform is, am I building this right? Is this right for the next 5 to 10 years?
Right.
And so those are the types of challenges I face every day, but I'm finding that it's actually going really well. Our billing systems are scaling, our operations are scaling, our scheduling scaling. So it's going to be challenging, but fun.
I love it. Okay, so my last question for you and for people watching out there, what can we, being in the Salesforce ecosystem, what can we do for you and your company? Is there anything that we can do for you guys?
Keep being amazing. I don't know, providing that support. I always tell my team, go to the community, go to events, ask questions, share. The Salesforce community is so great at that. And I want to make sure that all the new people coming in have that same philosophy. And maybe it's not something that you can do for me, but it's things that we can do for each other, which I think the big thing is mentorship. I owe everything to my mentor and my mentors as a whole. And I really love myself. My favorite part about my job is paying it back. To take somebody, for example, just a really quick story. One of my mom's best friends was working in a call center, let's say making $45,000 a year, really great benefits. And her husband couldn't work due to medical reasons. So she was like, oh, the benefits are really great. But she had a master's in mathematics in Germany, right? So it's like totally wasted mine. So we asked her, said, take a chance with us. Let's take a chance. And she came on, learned Salesforce. We mentored her. And now she works at a consulting firm, like making amazing money, lives in a new state because she can. And that's all I want for everybody. And that's the power of Salesforce. You can transform people's lives. And just by teaching them a skill, like I just taught her the basics and she ran with it. And now I try to hire her and she says, Alex, you can't afford me. And I love it. I love going from, I feel undervalued, but I need the benefits to, I can live in any state I want. My husband and my family, we're good. And I'm doing something I love. And that's just incredible. So keep doing that. Mentor, be a mentor, find a mentor, just keep paying it back because I owe everything to the Salesforce as a company, Salesforce, the community. And so I love to pay it back. I love grabbing college kids and saying, let me put you on a path because I was where you were about 6 years ago. So that's all we can do. Just keep being great.
I love it. Okay. So for everyone listening, reach out to Alex. He's going to be your mentor.
Happy to help in any way.
Yeah, I love it. Alex, thank you so much for joining us today. It's been really great talking to you more, getting to know more about your company. I really appreciate you taking the time.
Thank you so much, Kat. It was a pleasure for me. Thank you.
All right. See you later.